Hello everyone, again it's Dr. Jeffrey Scales. I'm here today to talk a little bit about a subject that is in the news right now. I think it's important to address. Before we get started, I'd like to highlight a piece of art I have in my office. It's entitled New Twist. It was created by a former professor of mine named Michael Harris, who I met at Morehouse College. He was one of the members of a black art collective called Afro Cobra. Many of them are still alive, and he was a person who was sort of a historian for that type of work. But if you look at this work a little closer, we can see that it's highlighting some traditional African symbols, and it has a woman of color with naturally curly hair, and the woman is highlighting the beauty of her natural hair. Right now, this is a very important topic, natural hair, and in the news lately, there was a study that talked a little bit about the risk of some of the chemical straighteners that people of color use to try to straighten their hair. This practice goes back quite a number of years. It is the result of black people feeling the need to change their hair texture, both to be accepted in society and also to be sometimes accepted into their own community. Chemical straighteners are added, which uncoil a naturally curly hair and straightens it out. It makes it easier to comb. It makes it easier to style in certain ways. And also, for many people, they feel that it's much more acceptable for them to be seen in society the way that they are. This most recent study that I'm talking about may have been something that you've seen, but it highlights the risk of uterine cancer when people are using these products. It's an interesting study because if you look at how it was put together, it was a questionnaire given out to thousands of women and asked them if they used straightening products frequently. Now, the word frequently can mean a lot of different things to different people. I've met patients who straighten their hair as often as once a week, and some people that don't do it but maybe once every 6 months. So the word frequently doesn't give us a lot of information, but it does say that these women felt like they were using these products quite a bit. Secondly, it asked them if they developed cancer. And the cancer that was most commonly associated with it was this uterine cancer that we had described earlier. Uterine cancer is a very serious disease, and it appeared that the people who used these products frequently, or self-described frequently, had a twofold risk of developing uterine cancer compared to those that did not. There are a lot of problems with trying to describe something like this, something as serious as uterine cancer with a study like this. And what it indicates is that more work needs to be done to talk about this. But I think it's important to at least discuss this. Is it possible that some of these chemicals may increase the risk of uterine cancer? Right now, it's too early to say. But I think if you were a person who was considering whether it's a good idea to use some of these products, you at least have to take a moment and think about this. Sometimes we choose risks knowingly, choosing things like smoking, driving without a safety belt, drinking excessively, using illegal drugs. These are things that we choose to do and we know that they have a risk associated with them. In this particular case, it may turn out that people are using things that were of some risk, but we just didn't know that a risk existed. I'm not saying that anyone that straightens their hair with these products should stop, but I think you need to take a moment and consider whether you think it's worth whatever risk may exist. It may turn out that there's no risk at all. It may turn out there's more risk than we realize. But I think it's important for people to think about these topics. As you can see from this picture, this is a very beautiful look, and some people feel very comfortable with it. It may be a look that you want to consider if you're a person who's chemically straightening their hair. It doesn't have to necessarily look like this, but God made your hair in a certain way, and perhaps it's the way that we should try to live with it if it means having to avoid a risk of uterine cancer. We'll talk more about this in later discussions. You have a good day.